1, 2, 3. Yep, good.
Megan's going to introduce you.
Yes.
Can we have everyone take their seats, please? Hi, everyone. Thank you so much for coming this evening. My name is Megan Steinkirchner. I'm the Forums and Content Specialist at the Executives Club of Chicago. And we want to thank you for being here at our Civic Affairs Forum event this evening. Our Civic Affairs Forum is chaired by Carrie McElwain from Lurie Children's Hospital, and we're very happy to have her participation with this. So it's my great pleasure to welcome you all here this evening to talk about the very important topic of children's health in the city of Chicago. The Voices of Child Health report named the top 10 health problems for children as identified by adults in the city across all 77 community areas. It's the first of several reports that will be released following the Health Chicago Survey Junior and contextualizes the challenges facing our youth today. A critical step in bettering the lives of our children. It uses parental concerns as the driving factor of health and safety for Chicago's youth and adolescents. And our speaker, Dr. Matthew Davis, serves as the Vice Chair of the Department of Pediatrics and Senior Vice President and Chief of Community Health Transformation at Lurie Children's Hospital. He created the Voices of Child Health in Chicago initiative as a way to bring the voices of Chicagoans to the forefront of child health engagement in the city. We're honored to have him here to lead this discussion tonight on this very topic, and please join me in welcoming Dr. Matthew Davis.
Thank you, Megan, and good evening, everybody. Can you all hear me in the back? Yep, okay, good. Welcome to Lurie Children's. For those of you who don't have your day jobs here, and for those who do have your day jobs here, welcome as well. We're thrilled to be hosting this evening this discussion about how to bring the voices of Chicago who are concerned about child health into rooms like this one and rooms across the city as individuals and organizations think about how to improve health of children and adolescents in our city. I'm going to share a bit about the journey to get here to something that we call Voices of Child Health in Chicago, and also set up an opportunity for us to have a conversation about how to bring more voices of kids and also many other community members into this conversation. Because ultimately, the successful improvement of children's health is going to depend on a team effort. It's not something that one institution can achieve. It's certainly not something that one organization and a community can aspire to. It must be a team effort, and it's got to be based on what individuals and families and neighborhoods identify as the needs of kids. I'm thrilled to be joined tonight by the members of the Voices of Child Health in Chicago team, including Marie Heffernan, if you just raise your hand as we go, Punreet Bahati, Ann Bendelow, and Tracy Smith, who's not able to join us tonight, I don't think. But Tracy is certainly part of the team as well, and is part of the Child Health Data Lab here at Smith Child Health Unit, and at Lurie Children's has been a big part of this idea since the very beginning. We go from childhood to adulthood, sometimes quickly, sometimes slowly, depending on the day, the week, the month, the year. That process is one that is familiar to everybody. This, by the way, is a photoshopped image, I'm told. The point is that we take growing up for granted, but growing up and growing up healthy is the main reason that we focus on child health. We want to make sure it happens in as healthy a way as possible with as much support as possible, because how kids grow up is fundamental to how they live out their lives as adults. So when we care so much as a city, and we do, about the health of grown-ups, we must, by association, care a lot about the kids today and the kids who those grown-ups were. So to understand health throughout the life course, we've got to start in childhood. Fortunately, compared to adults, a greater proportion of children are healthy, at least how the healthcare system generally views them. Of course, we're learning more, seems every day, about the early parts of health, the antecedents of health in adulthood that have their beginnings in childhood. Whether it's related to risks of heart disease, risks of mental health concerns like depression or anxiety, the effect of trauma on children's mental health and physical health. And the list is long, not just in terms of genetic sources of adult disease, but also experiential sources. In order to understand those better, we have many tools available. Many tools that we at this institution and many others like it are deploying every day to try to understand better how we can help infants, children, and adolescents be healthier and grow up into healthier adults. The basic science opportunities are in test tubes and animal models in labs. The translational science opportunities are taking those promising models, let's say, of a new medicine or a new treatment opportunity, and trying to see whether we can take them from an animal model and make it work in humans. Once we've found our promising models, then we do that same work in clinical trials to figure out if a whole group of patients or a whole neighborhood group can do better as a result of an innovation. And finally, in health services and population health research, we try to make sure that something that's working for an individual patient can be translated out to the entire population. This spectrum of research is something that a lot of institutions pursue. Here at Lurie Children's, we think of it as an integrated whole, as a way to make the maximum difference that we can. What I'm going to share with you tonight is really more in the health services and population research realm, something that we don't necessarily talk a lot about in rooms like this, but is fundamentally part of our research mission here. And the point of this is we're going to be talking about surveys, which are really familiar to many people. You might see a poll in the evening news. You might take a poll when you're on our webpage and you click an answer to a question. It's also possible to do that in a more formal way, a more statistically and scientifically rigorous way, and that's the sort of survey work that we do here. So when we talk about doing surveys of the population, there are many surveys that exist today regarding youth. Fortunately, over the last 2 to 3 decades, there's been a wellspring of interest in trying to understand better what the population is concerned about for child health, how kids are behaving, how youth are picking up behaviors that are either healthy or less healthy. One example of this is something called the National Survey of Children's Health, and some of the folks in this room were at the recent pediatric research meetings last week, and this resource was used by many scientists and is used by actually a couple of people in this room I've seen just here tonight to answer fundamental questions about what's going on for children and youth. The National Survey of Children's Health occurs now on an annual basis, but also has a lag in the timing of when the data are available. So you usually have to wait about 18 months to know what people were thinking 18 months ago. Something called Monitoring the Future, which is carried out at the University of Michigan, is in many ways the gold standard source of information about youth and their use of alcohol and substances. They ask high schoolers, 9, 10, 11, 12th graders, what they're doing, either in school, depends on how exciting the school day is, I suppose, or out of school regarding alcohol and substance use. And their questions give us a time trend over the years in terms of what the patterns are of use, but they only focus on alcohol and substance use. The Centers for Disease Control and Prevention, or the CDC, has something called the Youth Risk Behavior Surveillance System, or YRBSS, that does a good amount of what the Monitoring the Future group does, but does it over even broader category of behaviors, such as their physical activity and the sort of things they eat and the sort of relationships they have. Those data are also available at the state level and even at the city level for big cities like Chicago. And some of our researchers here are tapping into the strength of the Youth Risk Behavior Surveillance System to understand what things are like for kids here in Chicago over time. Again, these data are a little bit delayed. So for example, you can see they're very excited that the 2017 results are now available. And here we are in 2019. So there are delays there, and again, they only focus on the questions that they ask. And so far, we really haven't talked so much about what's going on for young children. A lot of the surveys that are out there are focused on adolescents. Another national effort that I started with colleagues at the University of Michigan called the National Poll on Children's Health is a national online survey carried out every 3 to 4 months or so regarding a much broader variety of topics, asking adults many of them parents, but not all of them parents, about various different topics, trying to be as timely as possible. And you see the topic for this month's report, most parents concerned about safety of teens using ride-sharing services. This is the only survey that's going to focus on that particular topic. They regularly focus on topics that are on the tip of your tongue and that you might have seen in the newspaper just a month or so ago. And in fact, these data for this month, here we are on May 2nd, were collected in February. So the turnaround time is much faster, and they're able to get the word out about these national trends to various different stakeholders. We were thrilled in our work before I left the University of Michigan 3 years ago that some of our data had been used to inform congressional lawmaking in Washington, D.C., and also at the state level, and also had been influential in helping other organizations, whether they be hospitals or public health officials, think about child health and risks for child health in different ways. So all these national surveys leave something key out. They leave out what the impact is of local efforts. And one of the things that we're trying to do here at Lurie Children's and with many organizations in the city is have, bless you, a local impact. You can't study local impact with a national survey. The only way to do it is to focus on the local population and have them inform you about whether they're seeing an impact of what programs are out there in the community or through institutions. So if we want to know local, what we've done here is to set up a way to do that, and that's what we call Voices of Child Health in Chicago. Here's a bit of our homepage, and it highlights our most recent report about parent concerns about bullying and cyberbullying. And the idea here is that we're asking parents in our city about what their concerns are, and then asking in detail what they are concerned about in the communities and what they would like people to do about it. We're doing this work in our first phase with the Chicago Department of Public Health as a partnership, and I'm going to say a bit more about that in a moment. Voices of Child Health in Chicago focuses on surveying Chicagoans, folks right here in the city, to better understand the issues that impact the health of youth. And we do so by gathering the public's perspectives. We want to hear their insights about the health of children and adolescents, and then we report those findings right back to the public to close the loop so that you don't have to, you're welcome to, but you don't have to ask your neighbor what they think. You can know what everybody across Chicago is thinking about these particular youth health issues. So in phase one, we're working with the Chicago Department of Public Health on a project that we call Healthy Chicago Survey Junior. The Healthy Chicago Survey is something that's been carried out since 2014 by the Chicago Department of Public Health, and they've been a great partner, and Dr. So is here tonight from the CDPH as part of the Bureau of Maternal, Infant, Child, and Adolescent Health. The Healthy Chicago Survey is a telephone survey of over 3,300 adults across the city that for this wave of data that we're sharing with you began at the very tail end of December 2017 and continued through the middle part of 2018. The great part of the Healthy Chicago Survey is that it includes respondents from all 77 community areas, all 77 neighborhoods across the city. That's important because the city is counting on the Healthy Chicago Survey to reflect the eyes and ears on the ground in every neighborhood that then they can reflect in something called Healthy Chicago 2.0 and the Healthy Chicago Atlas. That is a resource online that individuals across the city and beyond can use to understand better what the dynamics of health are in our city. So what we did was to talk with the CDPH about how we might add some questions regarding kids to the Healthy Chicago Survey. And with the support of the Founders Board here at Lurie Children's and also from an anonymous donor, we were able to bring some additional resources to the survey in order to add those questions. We call those questions the junior component for obvious reasons, and that is our first phase of Voices of Child Health in Chicago. Those 3,300 adult respondents include about 1,000 adults who are themselves parents of at least one child under age 18. And that's important because if we only surveyed parents, we wouldn't know what other members of the adult population in Chicago are thinking when it comes to youth health. Some of those individuals might be grandparents, some of those might be young adults, some of those might be middle-aged adults without children in the household. The important part of this is we want to hear all perspectives, because ultimately, if there are going to be policies and programs and initiatives in our city, it's going to take support from more people than just parents. Having an idea about how the overall community views youth health is really critical to success. We have here on the screen some of the health issues that we've looked at, and you have on your table a packet for each of you to take with you as you're interested of the 5 reports that we've produced so far on the topics you see on the screen, and we're going to take a look at some of these in more detail in the coming slides. One of the key parts about Voices of Child Health in Chicago is that we want to get a steady drumbeat of information out to the public about what Chicago is thinking regarding youth health. The general pattern in research organizations is to put out results after a very lengthy time of work, and that's a lengthy time that's often required. Here what we do is to set a different expectation that we're going to do the work we need to do to bring Chicago a new perspective every month. That requires an intensity. Thank you, Marie. And thank you to the team for making sure we can deliver on that promise, but the idea is to set up a relationship with the community of Chicago that they can depend on us to be sharing something new about youth health every month. So in Volume 1, Report 1, our debut issue that was published last December, we asked adult respondents about health problems facing youth in Chicago. We had come up with this list through conversations with members of the public health community and the healthcare community, and also basing it on many other surveys that are done regarding youth in the US. And for each health problem, respondents indicated whether they thought it was a big problem, somewhat of a problem, or not a problem. And on the next slide, you'll see the proportion of the adult respondents who said each of these things is a big problem for youth in Chicago. Again, these are not just parents, this is all adults. As you can see, the leading concern is drug abuse, followed by childhood obesity, and then child abuse and neglect. Just check your own thinking about whether those are the top 3 you were expecting. Take a look down the list at the others that were here. Stress among children and teens, depression among children and teens, smoking and tobacco, alcohol abuse by youth, parents' health problems affecting children's health, suicide among children and teens, and teen pregnancy. If you were to take a look at a standard public health report that's based on the number of cases of something, or the number of deaths related to a particular problem, or the burden of disease, that's another classic way to describe what's going on at the population level, this isn't the list you'd come up with. This is a different list from the public perspective. And what's important about this is that it is a way to have a conversation with Chicago about the health of youth that we haven't had before. This is an opportunity to talk with members of the Chicago community about what they're most concerned about. You can go into a room now and bet that the person, the adult in Chicago who you're talking to, is concerned about these issues. You may have thought that for some of them, but I'd be willing to bet you didn't necessarily think that about all of them. So this is an opportunity for a new set of conversations. Here are some differences in terms of the perceived scale of these problems, whether it's a big problem for individuals with at least one child under age 18 in the household versus adults who don't have a child under age 18 in the household. And you can see with the dark green bars here, or actually they're green there, but they're blue for you here, that parents were more concerned about every single one of these top 10. That you probably did expect. The degree to which they're more concerned is also helpful to understand. The ordering of the top 10 also differs a little bit. You can see that the parents' top 10 was slightly different than the adult top 10 who don't have a child in the household. You can see here on this slide some of the things that we asked about that didn't quite reach that top 10 list, but that we asked about, and I thought I'd show you here. If you see some of the things on the right-hand side of your screen that you thought might have ended up in the top 10 but didn't get there, I think it's helpful for us to know what the public is concerned about even more than some of the things on the right-hand side of the screen. For me, personally, as a researcher focused on the challenges of infant mortality, this is a wake-up call that if we're concerned about galvanizing the public about infant mortality, we need to message more about it. We also took a look in our second report about parents' refusals of influenza vaccine. We focus on influenza vaccine because we put this out in January, a major flu month. But suffice to say that refusal of vaccine has been a pretty big topic nationally in the last few weeks here. And we have information from Chicago parents about their refusal of vaccines in general. And what we found is that 14% of parents had refused vaccines overall for their kids, and the majority, 65%, had refused only only flu vaccine, whereas 24% had refused 2 or more, and 11% had refused 1 vaccine only. I'll share with you now that the vaccine most commonly refused other than flu was measles vaccine. The most frequent reasons for refusing vaccines were worry about side effects, perhaps not surprising. That's something that we can work on in healthcare and in public health. A third or so worried about long-term health effects, and another third feeling that the vaccine did not seem necessary. Those are all perceptions and opportunities for communication and also for community conversations about the importance of these issues and the opportunity to vaccinate to protect our kids. We also asked about social issues as big problems for child and adolescent health. In Chicago, it probably doesn't surprise any of you that the leading concern here is gun violence, followed by bullying and poverty. What I'm continually impressed by is the wisdom of the public when it comes to these concerns. The public understands just how influential these social issues are and understands how pervasive a problem like poverty will be for the health of children and adolescents. These are also opportunities for somebody like Mayor-elect Lightfoot to connect with the public regarding the health of children and adolescents in our city. We also asked about paid parental leave because this survey is an opportunity to talk about policy issues that relate to parents' ability to take care of their kids. We found that 4 out of 10 employed parents in Chicago said they did not receive paid leave. That was a surprise to members of the city council who said, wait a minute, we thought we passed an ordinance requiring paid leave for all employers or for most employers in the city. So that led to messaging encouraging parents in Chicago to ask your employer what their policy is. Make sure you know that you may have paid leave and not know about it today. And so as we think about how to add to this, we want to add to the voices and broaden the topics because we need to hear from teens. That's the most common feedback we get. It's probably teens letting us know they want to be heard. And we want to be able to hear from the same individuals, the same folks over time in order to be able to measure trends in their perspectives. Right now, Healthy Chicago Survey is a one-time call, and then the next time we're in the field, like right now, it's a different group being called. We want to invite the public to nominate topics, and that's what you're going to be doing here tonight, to join us in that effort. And we wanted to continue to connect to other sources of survey data to understand the local and national context. We always want to be aware of what other surveys are finding so we can understand what the Chicago story is within the national story. So in the near term, next steps, we're in the field right now with CDPH on the 2018-19 Healthy Chicago Survey Junior. We're going to be developing a survey of teens within the next 6 to 9 months here, and we're also going to be developing a survey of parents as a long-term panel in the city of Chicago over the next 6 to 12 months. That survey of parents as a panel, that means you are in the panel and you are asked to answer questions in a repeating fashion over a period of months to years, is going to be a unique panel nationally. There's no one else doing this work, and we're going to be doing it here in Chicago. So I welcome you to join our table discussions here. We have a couple folks who are smaller in number of tables, and perhaps you want to join a couple other tables to have more numbers and a more robust conversation. And so we'd like you to tackle these 3 questions over the next 25 minutes or so. Number 1, what youth health topics do you want to learn more about in the future through Voices of Child Health in Chicago? What questions do you have for the general population of Chicago about youth health for parents and for teens? How might you or your organizations use this information in the future? And how might you be involved in identifying topics that we should address in the future? How can we think collaboratively and strategically about funding for this kind of work? So we have some marker boards over here that we're going to move around the room. And we'd like a member of the Lurie Children's team at each table to be the scribe for the table and keep track of the conversation. And actually, at 10 minutes to the hour, then we're going to have a report out from each of the tables. If possible, we'd like to have a non-Lurie Children's member of the team be the report out person. And that will give us a chance to share ideas from each of the tables as we wrap up the evening. Please take a moment to introduce yourselves at the table if you haven't already.